Hello, nursing students!
I am Shikainam Katindoy,
And I'm Clarice Joy de la Peña, and
and
we
we
are
are
the
the
cholesterol
cholesterol
absorption
absorption
inhibitors,
inhibitor,
ezetimibe.
Ezetimibe. So my generic name is Ezetimibe, and my brand names are Zetia, Nexlizet, Liptrizet, and Vitarin, and my chemical name is C24, H21F2, and O3. My therapeutic drug classification is anti-hyperlipidemic, and my pharmacologic drug classification is cholesterol absorption inhibitor. My pregnancy category is C, which means that there are no adequate or well-controlled studies for pregnant women. However, should be used in pregnancy if the potential benefit justifies the risk of the fetus.
My mechanism of action is that I work in the brush border of the small intestine to decrease the absorption of the dietary cholesterol in the small intestine. And that results to my therapeutic effect in the body, which is the less dietary cholesterol being delivered into the liver. And the liver increases the clearance of cholesterol from the serum to make up for the drop of dietary cholesterol, causing to total serum cholesterol level to drop. In my pharmacokinetics, I am absorbed well after oral administration and distributed with greater than 90% of protein binding, reaching the levels peak within 4 to 6 hours. I am metabolized in the small intestine and the liver, and in there I undergo enterohepatic recycling with the half-life of 22 hours. After that, I am excreted in the kidneys and the bile, mostly eliminated in feces and minimal in urine excretion. For people, they do not know yet whether I cross placenta or I enter the breast milk. Now for indications and some dosages for patients. I am indicated for hypercholesterolemia and cytosterolemia. What are these diseases? So hypercholesterolemia, also known as high cholesterol, is the presence of high levels of cholesterol in the blood. So for adults, elderly, children who are 10 years and older, this is administered orally with initially 10 milligrams once a day. So this can be given with or without food. And for patients who are receiving bile acid sequestrant, this can be given, or ezetimibe can be given 2 hours before and can be 4 hours after bile acid sequestrant. Next is cytosterolemia. So this is a condition in which fatty substances from vegetables, oils, nuts, and some plant-based foods accumulate in the blood and tissues. So for adults and elderly patients, this is administered orally with 10 milligrams per day.
The following are contraindications and cautions for the use of ezetimibe. First is allergic reaction or hypersensitivity to drug. In rare cases, some people may develop an allergic reaction to ezetimibe. Signs of allergic reactions include severe rash, swollen face, and difficulty breathing. So if this happens, it is recommended to consult a doctor immediately. Is the combination technique or the concurrent use of HMG-CoA reductase inhibitor. So in some cases, the ezetimibe may be used in combination with another type of cholesterol-lowering medication called statin, for example, pravastatin and lovastatin. So if this happens, the liver function should be monitored by the doctor. Liver disease or reduced liver function may cause this medication to build up in your body, causing body effects. So if liver problems are present, discuss with a doctor. Further, this medication also causes liver damage. So if you are experiencing symptoms of liver problems, you should also contact your doctor immediately. Muscle pain or damage. This medication may also cause muscle pain or damage. So if you experienced unexpected muscle pain or damage, weakness or tenderness, consult your doctor immediately, especially if the symptoms do not seem to go away.
My next contraindication is pancreatitis, which means I may cause the pancreas to become inflamed. So if you're a patient who have history or at risk for developing pancreatitis, your doctors should be monitoring you closely. And if you experience unwanted pain, tell your doctors immediately. Next contraindication is pregnancy. I should not be used during pregnancy unless the benefits outweighs the risk. And if you become pregnant while taking this medication, please do contact your doctor immediately. Another is breastfeeding. It is not yet known if I pass into breast milk. So if you're a breastfeeding mother and you take me as your medication, it may affect your baby. So you should talk to your doctor whether you continue breastfeeding or not. Lastly, it is also contraindicated to children below 10 years old. It is because my safety and effectiveness have not been established to children below 10 years of age. So therefore, I am not recommended for their use.
Along with its needed effects, cholesterol absorption inhibitor or ezetimibe may also cause some unwanted effects. Although not all of these side effects may occur, it also needs some medical attention. So some of these side effects are dizziness, headache, fatigue, abdominal pain, arthralgia, sinusitis, and pharyngitis.
Let us go to adverse effects per body system. In general, these are the most frequently reported side effects. These are the upper respiratory tract infection, diarrhea, arthralgia, sinusitis, and pain in extremity. For gastrointestinal, we have abdominal pain, diarrhea, flatulence, nausea, pancreatitis, and constipation. The musculoskeletal adverse effects is arthralgia, pain in extremity, muscle spasm, and neck pain. For the respiratory, we have upper respiratory tract infection, sinusitis, cough, and dyspnea. For the hematologic adverse effect is thrombocytopenia. And for the central nervous system, depression, dizziness, and headache. For the cardiovascular, we have hot flash and hypertension. For the dermatologic or the integumentary system, we have angioedema, rash, urticaria, erythema multiforme. For the metabolic, we have decreased appetite, and for the other systems, we have common, fatigue, influenza, chest pain, and creatine phosphokinase increased.
So before nursing interventions, the nurse should perform first physical assessment to establish baseline data. It is also important to determine the effectiveness of the drug therapy and to check for the occurrence of the adverse effects. Next is to assess for the hypersensitivity to drug, and then obtain a diet history regarding fat consumption. Next is to obtain serum cholesterols, triglycerides, hepatic function tests, and blood count during initial therapy and periodically during treatment. And then treatment should be discontinued if the hepatic enzyme levels persist more than 3 times the normal limit.
You should also include in the before nursing responsibilities to conduct patient and family education about the following. First is to instruct patient to take medication as directed. If a dose is missed, omit and resume usual schedule with next dose. Do not let patient double up on missed dose. Next is, you should advise patient that this medication should be used in conjunction with diet restrictions. For example, fat, cholesterol, carbohydrates, and alcohol, then exercise and cessation of smoking. The nurse must also instruct the patient to notify healthcare professional promptly if unexplained muscle pain, tenderness, or weakness occurs, especially if accompanied by fever or malaise. Moreover, the nurse should also educate the patient not to stop the medication without consulting the physician, and then educate them on the possible adverse effects to expect and to report it to the doctor. And last but not the least, educate them the importance of the drug therapy. After the drug has been prepared and the patient has been educated, we now go to the nursing responsibilities during the administration of the drug. So first, we should give the drug as ordered, following the safe and appropriate administration to ensure beneficial effects. The nurse must administer the medication orally as a single dose any time of the day, without regard to food, and the nurse should let the patient swallow it in whole. Do not crush it, do not break, dissolve, or chew the medication. The nurse must also provide comfort and any safety measures to help patient tolerate the drug side effects. This drug may also be given at the same time as statins, so give at least 2 hours before and 4 hours after cholestyramine, cholestyramine, and cholecalciferol. And the nurse must monitor daily pattern of bowel activity and stool consistency. Lastly, the nurse must also monitor serum cholesterol and LDL level to determine the effectiveness of the drug therapy.
So after nursing interventions, document data after administration, and then perform periodic laboratory tests, and then assess patient for signs or symptoms of back pain or abdominal disturbances, and then monitor for effectiveness of comfort measures, monitor for the compliance of drug therapy regimen, monitor for patient response to the drug therapy as evidenced by normal serum cholesterol level and LDL level, and then monitor for the adverse effects, for example, muscle pain, and then evaluate patient understanding to the drug by asking its name, its indication, and adverse effects to watch for.
Thank you so much for watching. We hope you learned and enjoyed.
Bye!
Bye!